In this video, I want to talk about a medical investigation that every couple must be done before getting into a marriage. Before you decided to spend the rest of your life with someone, it is really vital to know your partner health status if you don't want to end with having a problem in your matrimonial life. Again, in this video, I want to share the importance of doing each medical investigation, and I want to share the problem that may occur if you haven't done any one of these medical investigations before a marriage. If it's the first time to watch our video, I would like you to support us by clicking the subscribe button and hit the notification bell so don't miss out on our upcoming educative videos. To the returning subscribers, thank you for supporting this educative YouTube channel. Starting with the number one, which is HIV, hepatitis, and other sexual transmitted infections medical investigation. Study shows that 50% of the people that are living with sexual transmitted infections, they are unaware they are infected. That is why you and your partner, it is really important to get tested before getting into a marriage. The number two, which is thalassemia test. Thalassemia can lead to a lot of birth defects to your future children, and that is why you and your partner need to get tested before getting into the marriage to prevent the problem from occurring. Thirdly, is mental health status. A test of mental health status is really vital to the both partners to prevent a problem from occurring to your matrimonial life. Because there is a lot of mental health problem that can pass from one generation to another, like schizophrenia and so on. Doing this medical investigation, it is really important to prevent a problem from occurring. The number four is genotype and the rhesus factor compatibility. Nowadays, there is a lot of people that are falling into love without knowing their partner's genotype and the rhesus factor compatibility. When you fall into love with someone since before marriage, it is really vital to know your intending spouse, rhesus factor, and genotype compatibility. Because if you marry somebody without knowing this, you will end up with having a problem in your matrimonial life, like a sickle cell anemia and a spontaneous abortion to a wife. The number five medical investigation that you need to do before marriage is blood group test. Do you know that not everyone can donate a blood to each other? Knowing your partner blood group before marriage is really important because there is a lot of blood groups which are not compatible with other blood groups. Also, it can cause a lot of complications during a pregnancy. The number six is fertility test. Nowadays, there is a lot of couples that want to get a baby immediately after marriage. That is why it is really important to run a fertility test before you get into a marriage, so that you can know if your body is fit for the fertility and the reproduction. The number seven is genetic medical history. Be it a diabetes or hypertension, it is really important to know your partner's genetic health status. Any existing chronic disease to your partner like a hypertension and diabetes mellitus can affect the outcome of a pregnancy. That is why it is really important to know your partner's hypertension and diabetes mellitus status. We have come to the end of this video. If this video added a value to your life and you need another episode, let me know in the comment section. And don't forget to subscribe to this YouTube channel and share this video to your family and friends. See you in the next video.